were classified as COVID deaths. And how can you say they died of that and not of the dementia, especially when there's no autopsy? So I think there's a lot of miscounting, but you know, you're right. I would not rely on the test at all, because basically what happens is the more testing you have, the more cases you have. There's a pretty linear relationship. So you can easily control those numbers just by doing more tests.
But what I would like to say is, if there's any new virus that exists, there's never going to be a gold standard. It's a
sure there. The gold standard is very easy. All you do is you take a set of, say, 100 or 500 patients, you isolate and purify the virus, and that you can show that what it is by a chemical assay. And then you compare a surrogate marker test like a PCR genetic test, which, by the way, is not really something that should be used for diagnosis. And we could talk about that if you want, but you could find another surrogate marker test and then compare the results statistically to the gold standard. Then you calculate your error rate, your positive predictive value, your sensitivity and specificity, right? All those things you learned in your epidemiology class. But you can't do that for this at all. So, you know, when I was in medical school, I remember it was, they made a point to stress that, you know, new tests should be compared to the gold standard. And I remember them discussing the VQ scan compared to a pulmonary angiogram. And those are tests for a blood clot in the lungs, and showing us how problematic it is with the VQ scan, actually, which is much easier to do than putting a catheter and threading it through and putting dangerous dye into a person for the gold standard test. But we simply have none, and there's not one paper. But also I want to add, as far as contagion from asymptomatic people, there's really just one study on that that's come out, in addition to some epidemiologic data. And in that study, there was a COVID positive person who had close contact with 455 COVID negative individuals, and not a single one of them converted to positive. And then you have the data on children. There's not been one documented case of anyone being exposed and getting sick from being exposed to a child who is positive. So based on that data, there's really no evidence that, and additional data, there's no evidence that social distancing would be helpful. There's no evidence that masks are helpful. In fact, there's even a study that shows an increased risk of getting the flu by wearing cloth masks compared to no mask. So we're talking about doing these things with no evidence whatsoever and no historical precedent for these procedures ever being done to prevent the spread of any illness.
Just a couple weeks ago, a representative at the WHO came out and said it's very rare that an asymptomatic carrier of COVID-19 actually transmits the virus to another person, based on the studies that haven't been released yet that she was talking about.
We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare. And that much of that is not published in the literature. But from the data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a secondary individual.
And then the next day, they scrambled and came out and said, oh, what she said was a misunderstanding, and we actually don't have an answer for that. So I was wondering, like, what did you think of that when you saw that?
Well, I heard about that immediately, and I put the quote and put it in a slide for my presentation on masks, because it's very important and it's consistent with the already published data. When they backtracked the next day, I realized that that person spoke out without being authorized by the leadership of the World Health Organization or their, PR consultants, because it goes against their own policy of recommending all of these measures. So obviously they don't want to see a conflict there, but that's not the first time that they have flip-flopped or contradicted themselves. Initially they recommended no masks. Then they changed it to recommend masks. And even on their website, they have a guidance, but they don't present any studies that give an evidence base to support it. So what I think here is you have like a mistaken disclosure by someone who thought, they were telling the truth. And then they were, this happened to other people that I know of, like some physicians. Like there's one physician specifically, who made a public announcement about the hospital being empty that he worked in, and he thought that, you know, this would help settle down the anxiety of people in his community. It was a small community, and the next day he was taken into the CEO's office and told to silence himself. So I think it's something akin to that.
I'm just I don't understand why you would speak so much about this and not want to maybe join a lab or do something to show that, yes, this definitively does exist by these methods, which I believe are more rigorous, even though it's already been sequenced, which I think is sufficient to say, to prove its existence. But you have very rigorous methods, and why would you not do something like that if it's something like sharing to other people, which you've been doing the past couple of weeks?
Sure. Well, Hunter, let me ask you, so I've been censored off YouTube. I've been called names. I've been accused of not being a doctor. I've been debunked by Reuters, despite having, you know, probably millions of people seeing my presentations and it being translated into at least 5 foreign languages. Not one mainstream media has called me for an interview. And do you think that a university would hire me, or that the government would give me a research grant to do this based on the way that the mainstream, you know, has looked at me? But even if that were possible, like, that's not really my goal in a career. That's not what I'm passionate about. I've done laboratory bench research before. I've done PCR tests before. But I like working with individuals, doing consultations. And the reason I'm speaking about this now is because our government has taken unprecedented steps to take away our freedoms with no scientific evidence to support the effectiveness of those measures. And I'm concerned, extremely concerned about this, that it's going to have devastating long-term effects. I don't think that we're going to be given back these freedoms. And I don't want my children to live in a tyrannical type of regime. And so that's why I'm spending so much time talking about this, because the consequences of this policy is so huge. And, you know, it's like I feel compelled to get out this information because I see this as a great injustice.
Well, I'm definitely not one to speak about the moral implications, and that's not why I'm here, but I respect your concern for things like that.
I wanted to ask you, Hunter, how do you feel that Dr. Kaufman is presenting information that goes against what thousands of medical professionals and doctors that have written research papers and basically saying that they're wrong? Like, does that make you feel type of way? Does it make you feel confused? How does that make you feel?
Yeah, I would guess, yeah, I'd agree. It makes me feel a little bit weird, you know, seeing something that's in such a renowned medical journal and then kind of understanding the weaknesses. And I feel like there might be, I think I need to speak to other experts who are actually virologists, who are actually epidemiologists, who study these things and can speak to the evidence, because, as you know, I'm a impressionable medical student, and I think that I just need to look more into it on my own for sure. But to say that I'm to the point where I'm going to deny anything like that would be quite a stretch. I mean, I'm still going to continue to maintain the views that I had, and I think that this pandemic is real. I think it's happening. I think we should all, if we don't want to transmit it to loved ones, we should isolate to a certain degree so that that doesn't happen. And I know that the evidence, the epidemiologic evidence points to this and points to the transmissibility of this virus.
Well, I mean, I'm sorry to hear that, Hunter, because the evidence actually points to the contrary for asymptomatic people. And I quoted, you know, the one published study so far, and you know that the World Health Organization has more data coming out to support that, as announced by one of its members. But, you know, I understand it's really difficult because this is like a total sea change of like a deeply held underlying belief about viruses. And it also contradicts your career choice, and you're in the midst of the training and you're excited about being a physician and you've invested a lot of time and money into that already. And it took me years to unwind from that and get to the point where I'm at now. Like, this didn't happen suddenly. You know, I was still actually practicing conventional medicine until just a month or two ago, when I was let go from my job because I didn't want to wear a mask and practice psychiatry. So I definitely understand that it's a process. And, you know, even just the virus dogma itself, like just for COVID-19, I spent, gosh, hours and hours and hours reading papers before I was comfortable with this conclusion and speaking out about it. And I know I didn't get everything right because I've learned from people subsequently some things, and I've looked at more evidence, and I've fine-tuned my impressions. Most of us are just like as a physician, right? We don't actually question the things that we do. We don't look at the primary evidence to support what we're doing at the base level, because we're just so, you know, we already know that. Like, you know, you don't need to tell us that germs cause disease, because I knew that when I was 3 years old, right? And so you just never look at it. You always take it for granted. But the nature of scientific inquiry is actually based upon questioning everything, right? It's still called germ theory because it hasn't been proven. It's still a theory. And the goal of science is to keep challenging and trying to disprove a theory. And if you're unable to disprove it, then it becomes a scientific law at some point.
So it's quite a bold statement for Dr. Kaufman to say that all these thousands and hundreds of thousands of doctors, they're just being indoctrinated and they're not actually questioning for themselves. And I want to know, like, Hutcher, how you feel about how, like, that's a pretty bold statement.
Yeah, in an ideal world, when something is published and is shown to be true and you undergo the rigors of the methods and they show overwhelming evidence of the existence of something, then it's something you should believe, and doing otherwise can be very harmful, especially since so many, not just doctors, but scientists who literally devote their lives to understanding these things, to say that they're all wrong and that their methods are incomplete is, I don't know. I just don't know what to say about that. Yeah,
well, you know, I think it's important to separate physicians from scientists, because you know, physicians are concerned with taking care of patients, doing clinical work. And I mean, almost all the physicians that I know, even at Duke, most of them despised reading scientific papers, and especially didn't like doing statistics or looking at the math, right? I mean, like, we had to pass like this test doing some statistics, and it was like the highest fail rate of any exam in medical school, right? And see Hunter's laughing. He knows this is true. So, but it's not necessarily their responsibility to scrutinize all the science, because their responsibility is to do clinical practice. Yeah. It's only when they need to explain something on their own observations that doesn't add up, right? And that's how I came to this too, because you know, I'm much more of a physician than a scientist, although I've done scientific work in the past. But among scientists, it's a different thing. They have. I do agree that they have a lot of responsibility, because policies and people's lives are impacted significantly by scientific findings. And if there's poor quality science, then you know, it's going to harm society and individuals, depending on what it's related to. So when, you know, Professor Ioannidis put that as one of the most cited articles in the scientific literature, that half of all published scientific papers are false. I mean, think about that for a second. This basically tells you there's a major crisis in scientific integrity. And there are certain, there's a lot of standards of scientific experimentation. And there really is, I mean, really, science should always be challenged, because if it's true, challenging it doesn't harm it at all. But if you challenge it and prove it false, then you can move on and not be stuck with a dogma that's not true. But things like, you know, procedures, like having controls, that is a standard experimental procedure that you need to have a good experiment. You need to have reproducibility, right? So there are a whole set of things that you need to do to have good results and be certain of your conclusions. And there are different levels of how good evidence is. Even in medicine, they have like a grading system depending on the study design. And like the gold standard for a clinical trial is randomized controlled trials. But there are other kinds of studies. There are observational studies, cohort studies, and these are not as certain. So you have to take those results with a grain of salt compared to the randomized controlled trial. So when you look at epidemiologic evidence, for example, that's one of the hardest types of things to draw conclusions because there are so many unaccounted for variables and so much error with the data collection because it's not designed in advance in a controlled setting. You can't do controls for epidemiologic studies. So you do have to look at these different levels of evidence in a different way, and you do have to see, did the scientists follow the types of protocols that are shown to give you high quality results that could be reproducible. So it's, so if you're a scientist in your field, it's important to look at those things. And if it's not in your field, this compartmentalization really hurts us because it's like the left hand doesn't know what the right hand is doing. When I was doing research as an undergrad in a molecular biology lab, I remember some of the grad students talking about that you can't read a virology paper, it's written in a different language. And now that I've tried to understand these, I totally see what they mean. And what they really meant is the procedures that they're doing doesn't make doesn't make a lot of sense because like they say they're isolating, but they're actually combining, right? And all these things like that. They say they sequenced the genome, but what they did is made a theoretical model from little tiny fragments. And so it's very confusing. And, now, I have a stronger opinion about it because I've looked at it very carefully. But this is not good quality science. And they have the procedures and the methods that are well established to make it good quality. So you got to ask, why aren't they using those procedures?
There's a lot of different perspectives. So how do we know who's right? Like right is subjective, right? So it's kind of hard for people that are trying to find the truth and answers. There's all different perspectives. They say they're right. You say you're right. How do we make sense of this?
Yeah. So Marshall, I can definitely, so one thing is I want to just make sure everybody knows that I don't expect you to just take what I say as the truth either. Like I want to challenge you to actually look at this information yourself and make your own opinion. But don't make your opinion by just listening to an authority figure or a designated expert. Make your own opinion by looking at information that's as objective as you could find. I know not everybody can read a scientific paper, but that's why I try to explain the papers to people so they can at least have a cursory understanding of what's going on with the actual science. But it's really telling when you see criticism or debunking when it uses things like name calling, right? Or it's like saying someone's a conspiracy theorist or wears a tinfoil hat or fake news, because that's not a rational argument. When somebody doesn't have a rational argument based on science, they use techniques like that to win the argument because it basically takes it away from the actual elements of reason and puts it into just discrediting someone's qualifications. So that's a sure tell. If you see that, like I never do that when I criticize anyone. And I think if you see that, you should then discount what that person's saying largely because, that's not an actual argument. And, there are people that have called me names, have even said that I'm not even a doctor, right? Which is pretty easy to verify. But, I don't care about all that, but I can't take someone seriously unless they give me an actual scientific argument. And I've always asked people that if you have a paper that shows, evidence that contradicts what I say, like I would love to see it. I want to know about all of the important scientific experiments so that I can judge for myself. And, I don't take what other people say as truth either. I try to make my own opinions. But, if I'm just talking about science here, like my opinion may be different than the mainstream, but I'm not making stuff up. You can see I'm going through the papers. I'm getting my information from government websites, and I'm interpreting it the best I can. So why would I be censored so heavily? You know, I have had many videos and interviews that have been taken down. And why would you need to do that? If I'm talking nonsense, then it should be easy to argue the opposite point successfully. And I'm not making any, you know, crazy medical advice. I'm not telling anyone to go out there and, you know, take 20,000 milligrams of vitamin C or anything like that. Simply reporting on scientific papers that are peer-reviewed, and I'm giving my interpretation of them. So why would they have to take my videos down and censor me? Why would they give false criticisms? Why would they use ad hominem attacks? The only interpretation I can say is that it's because there's truth to what I'm saying, and they're threatened by it because it will make people, if people agreed with me, then they wouldn't stay in their homes, and they wouldn't wear masks, and they wouldn't worry about dying.
Hunter, what are your thoughts on his things being discredited and him being called a conspiracy theorist and some of his interviews being taken down? Do you think that misinformation should be removed, or do you think misinformation should at least be presented to the people and then them make their own decisions? What are your thoughts on misinformation being taken down or being put up?
When you're promoting things that are harmful to society, I think there's a reason to take things like that down, because people are susceptible to being influenced by that, and it can be harmful to them as well. But there's definitely a balance to be made between, you know, freedom of speech and then something that can be damaging to society. And to find where that lies is a really complicated and philosophical question that I probably don't have the credibility to answer.
I'm kind of shocked to hear you say some of those things, Hunter, because in this country, we have freedom of speech, not just the speech that people like. And, you know, you say it's dangerous to criticize the medical system. I say it's dangerous not to criticize the medical system. Johns Hopkins reported 250,000 deaths a year from medical errors. The Journal of the American Medical Association reports 128,000 deaths a year from prescription drugs used as directed. That's 378,000 deaths a year. That's the third leading cause of death in the country caused by medical care. It's imperative to criticize that so that these deaths do not continue. So I do criticize that, and it's important. Like, you can't choose what is given free speech to, and then, you know, say, well, you know, based on this or that. It can't work that way in order to be free. Like, if you say something that is bogus, people will see through it if they do their own research and analysis, or just think about it carefully. And really, anything should be okay to talk about. But, you know, the YouTube has community guidelines, right? That they don't want material to be for children that is going to be adult, like about sex and with cursing, right? And so they have a legitimate argument to protect children from adult material. And they also don't allow like snuff films and sensationalized violence. But when there was the video of George Floyd being murdered by a police officer, they didn't censor that. Yet they censor me talking about scientific issues. So you've got to wonder what's going on at the leadership of Google that they're making these decisions. And it even the president of the United States issued an executive order basically telling them to stop, because these aren't like a private, these platforms like YouTube, for example, you know, it has become a platform for journalism and independent thought and exchange of ideas. And it's very important to the public discourse, because the mainstream media is owned by only 6 companies, own all of the media outlets. And if you look at that, you can see they all give the same exact message pretty much. There might be somebody here or there like Tucker Carlson, and I'm not advocating for Fox or anything like that, but he does say things that are different, but he's on an island. Everyone else, practically whatever you look at, they're giving the same exact story, and oftentimes using the same exact words even. So it's like critical to to the future of this nation, to have a free and open debate and have free and open speech. And that's what our forefathers set out to create, because the only thing that comes with censorship is tyranny.
Yeah. I don't think I represented myself well or expressed myself well when I said that. When I was saying I do not believe that people should not be able to question the medical community. I mean, we make that very clear. Like, that is definitely not true. What I was talking about the fine line is, like, for example, it's illegal to shout fire when you're in a movie theater, something like that. It's obviously harmful and you're not getting anything out of it, and you can hurt people in the process. So there is a line that needs to be made. And when I was not talking about criticizing medicine, the medical community, what I was referring to is promoting things that could be harmful to people. When you have guidelines on YouTube, then those need to be followed, and I think there's a reason they're in place.
But they don't have any guidelines that prohibit scientific discussions.
Dr. Kaufman, do you think there's some sort of motive or agenda behind censoring information that you're talking about?
Well, of course there is. I mean, the motive is that it threatens the narrative. You know, the narrative is that there's a deadly virus that's the biggest health crisis in 100 years, and we need to take extreme measures, shutting down our entire, basically, lives. And anything that threatens that is considered dangerous to that, process, that goal. And, that's why the people that have been censored, by and large, over this time period have all been basically giving information out that contradicts or argues against that main narrative. There's an interview with the CEO of YouTube. And what she said is basically that they were going to censor any video that disagreed with the World Health Organization recommendations.
Anything that would go against World Health Organization recommendations would be a violation of our policy. And so remove is another really important part of our policy.
So if I say that there's not evidence of a virus being isolated, that disagrees with the World Health Organization. So based on that ground, it could be taken down. But if the World Health Organization is not correct, isn't it the job of other people to point that out so that we say, well, we shouldn't follow their recommendations if they're not correct? They've been incorrect many times before, right? Neil Ferguson made those predictions. He's the scientist from the UK, the one who broke his own rules to go see his girlfriend. It was kind of a scandal.
Yeah.
But he's the one who did the mathematical models projecting millions and millions of death, which obviously was very wrong. But he actually predicted that many times before for virtually every outbreak, and he's been wrong every time, like Zika, Ebola, SARS, MERS, all those things. He's done a similar analysis. And it's important to point out that he's been wrong so that you don't listen to him being wrong again, because it was that fear that there were going to be hundreds of millions of deaths or whatever it was that he predicted. It was 2 orders of magnitude higher than even the most liberal estimates that have come out from actual epidemiologic data. If you continue to follow his advice, you're going to do things that are wrong. And so it's important that he's criticized and that this is made public so people say, hey, let's not listen to that guy again. He's been wrong every single time. Right? And that's why, that's just one little example of why it's important to show, right, or to show that the World Health Organization puts a policy statement recommending something, and then they have a reference section. And if you look at the references, you see that there's not one of them supports the policy. Well, you need to point that out and say, well, then why are they recommending this policy if there's actually no evidence to support it? Right? Because these things are affecting everyone's lives, right? People have lost so much from this, right? Even my children, they haven't been, now we have found some children that we can have play dates with, because I won't let my children wear a mask. But they're best friends from school and stuff. Once they close down school, they haven't been able to spend 1 second of time with them because all their parents are worried because they're listening to the World Health Organization recommendations and those recommendations being parroted on the news channels, right? But there's no need for those precautions, and there's no evidence whatsoever to support them. So it's really important to be able to challenge these things. And I don't want, I mean, if we're in a world that we can't challenge the authorities, then we're basically giving them free rein to tell us or do whatever they want for whatever purpose, and we can't challenge it. We just have to go along with it. That's not a free world.
Dr. Kaufman, what would be your advice maybe to Hunter? Because you've been through the whole medical school process, just say it very bluntly. Like, what do you think Hunter should do, even though he might not agree? Like, what do you think his advice should be as a medical student and going down this medical path?
Well, it's really tough, because we each have our own path, and mine is different from Hunter's. If it were me going through that again, I wouldn't stay in medical school, but that's me. I'm different, But I would say that, try to question things and also pay close observation to what happens when you do things with your patients and what's the outcome. And trust your own observations. Like, if you see things for yourself, you'll make much better conclusions than if you, just like a lot of doctors keep up with new research by like some kind of service like Medscape that sends you an email on a weekly basis or, a regular basis. And I think most doctors, they don't have really time to look at these things, and they just go through the headlines. And I can't tell you how many papers I've read where the headline does not match up with the actual findings in the paper. So you're going to be very much misled if you just read the headlines. But if you pay attention using your own observation, which is the most powerful thing, and when something comes up that you think is not exactly right or you have questions about it, then try to do your own research. Try to train yourself how to read a scientific paper. Make sure you understand statistical analysis. It's very, very important because your patients' lives are going to depend on you having an appropriate understanding of that information, and you want to do the best you can. And that it'll either make you a really, really good doctor, or maybe it'll have the same result as it had for me, where I realized I couldn't practice under mainstream allopathic medicine because I wasn't able to actually help my patients in a meaningful way.
Well, I appreciate your time to discuss these things with me.
Yeah, Hunter, it was really great and brave of you to come here and,
Thank you. I gotta say, I was pretty nervous. I was pretty nervous about being,
you should actually be proud of yourself that you were willing to come here and be somewhat open-minded about things and have a high-level discussion. This is all fantastic. And I want to make you an offer that if you ever want to learn anything about natural healing and nutrition, I would be happy to have a discussion with you and give you some resources and tell you about the kind of outcomes that you can have outside of allopathic medicine.
All right, I appreciate it. Thank you guys so much.
Thank you, gentlemen. Thank you for being open and willing to have this discussion, even though you have different points of view.
All right, great. Thank you so much.
All right, guys.
All right, thanks, Marshall.
All right, goodbye.